My name is Monica Montgomery Steppe, and I'm proud to stand here with my colleagues to celebrate a significant milestone in elevating our behavioral health services and care. Back in May of this year, I saw an opportunity to partner with UCSD Health as they purchased the former Alvarado Hospital in District 4. From there, my office hit the ground running with working out possible negotiations and leveraging more resources for our community members who are struggling daily. One of the most critical crises our county is facing is a shortage of behavioral health services for our low-income community members. Research from Rand Corporation shows a shortfall of nearly 2,000 beds across the state at an acute level. Additionally, nearly 1 out of every 20 San Diegans are currently living with serious mental illness. Now more than ever, we must treat mental health as just as important as physical health. As elected officials with the power to transform our region, we must build a system of care that reflects mental health care as a right and not a privilege. For years, we have discussed the lack of resources for low-income communities needing care. For far too long, individuals, specifically in our East region, have faced barriers of limited access to behavioral health services. Today, we are changing that narrative. Today, we are taking real, tangible action to close the gap in mental health services that have been underfunded, under-resourced, and out of reach for so many in our region, and instilling a sense of optimism for our future. As a result of my board letter back in May, the board officially authorized $32 million to invest in 30 inpatient treatment beds for our region. These 30 inpatient treatment beds will be specifically designated for the care of individuals on Medi-Cal, serving our most vulnerable population who have historically faced more barriers to accessing care, who historically have been receiving lower quality care, and ultimately experience worse health outcomes. These 30 beds represent more than just a number. They represent 30 opportunities for healing, recovery, and new beginnings for people who had felt that all hope was lost. For those on Medi-Cal, these resources may not have otherwise existed. This new project has the potential to provide an absolute vital service through both the inpatient treatment beds and the establishment of a new crisis stabilization unit, the first CSU for adults in District 4, which will provide quality intensive care for our neighbors experiencing a psychiatric emergency. Additionally, this partnership with UC San Diego Health is not just about beds, but also about closing the gaps in our behavioral workforce by providing top-tier training from its robust psychiatric department. This initiative brings a unique opportunity for the county to establish a hub of academic excellence and high-quality workforce development that will strengthen the county's behavioral health system for decades to come. We stand here today with the common goal and desire to provide patients with the compassionate, evidence-based care they deserve. This collaboration speaks to the power of working together for a partnership that has the potential to transform the lives of those who need it the most. I also believe it's important to note that demand for behavioral health care beds is likely to continue growing with SB 43 implementation coming on January 1st. We must ensure that as a county, we are setting our residents in need of services and our healthcare workers up for success as we take on this new initiative. Our journey towards securing comprehensive behavioral health care is ongoing, and this is just a part of that journey. I am fully committed to pushing for even more resources and solutions to meet the needs of our communities and our community members. I'd like to thank you, and with that, I will introduce my colleague who supports this initiative, Vice Chair and Supervisor Tara Lawson-Remer.
Thank you. Thank you so much to Supervisor Montgomery Steppe. I truly appreciate your leadership in driving this vital behavioral health project forward. It's another example of our proactive, innovative approach over the last 3.5 years to add mental health and addiction treatment capacity at all levels, facilities, staffing, and services. I also would like to thank Patty, Steve, and the entire UC San Diego team, along with our County Behavioral Health Director, Dr. Luke Bergman, and his team for their extraordinary commitment and dedication to this project. We're building the kind of behavioral health system our region needs, one that is more efficient, that fills gaps in the networks, and meets the needs of all San Diego residents. This new facility will ensure that we're supporting our most vulnerable community members. These are the folks that rely on our county for their health care, our Medi-Cal recipients. So, maybe it's a family with kids that lives in Mira Mesa who are struggling to make ends meet, and the father needs help managing the stress and anxiety of putting food on the table and keeping a roof over their head. Or possibly it's someone who has been cleared from a homeless encampment and is working to get their life back on track, and they need trauma-informed care after being chronically homeless. I want them and all San Diegans to know that with this new project, our county is here for you. It will bring 30 new inpatient psychiatric beds that includes 24-hour observation and intensive treatment, along with short-term crisis stabilization services. By investing in this facility, we're taking another significant step forward in ensuring that people in crisis can access the care that they need whenever they need it. So now it's my pleasure to welcome our Director of Behavioral Health, Dr. Luke Bergman, to say a few words. Thank you.
Thank you. Thank you so much, Vice Chair. I want to begin by, in addition to thanking the Vice Chair, thanking especially Supervisor Montgomery Steppe, who I would say instantly saw, understood, and made a commitment to pursue this vision. Versions of which had been kind of a long-standing preoccupation with the county. But what we've managed to do during the relatively still youthful duration of her tenure here is really an incredibly punctuated leap forward in making progress towards a much better behavioral health continuum here. One of the things I talk a lot about in the context of behavioral health generally is that we disproportionately invest in the notion of crisis in behavioral health and in responses to the immediacy of crisis without privileging investments in what we know needs to be long trajectory care. And one of the things that is really most beautiful about this initiative is that it's an investment in something that we need right now. Supervisor Montgomery Steppe noted the data from RAND that highlight a profound shortage of the kind of beds that we're going to build here. But this is responsive to a necessary vision for the future. It is doing something critical now, but it is an investment in the future of behavioral health in this county. It is establishing capacity to provide best quality care, to be the seat of the most innovative work in behavioral health. And it gives this county an opportunity to be a center of gravity, not just in Southern California, not just in the state of California, but in the nation, a center of gravity for the engendering of the behavioral health workforce, which is probably the most pressing concern that we have in this work. I could not be more thrilled and gratified to stand before you today and to be a participant in this wonderful and still evolving project. And with that, I'm going to introduce Patty Mason, who is the CEO of UCSD Health.
Great, thanks, Luke, and good afternoon, everyone. I think it was almost 8 years ago that I had the opportunity to meet with the head of Health and Human Services, Nick Mascione, who was in that position at that time, and we started hatching this idea about what could we do if the county and UCSD, a public institution, came together and tried to create something that was not done anywhere else, that was going to be transformational, that was going to be something that would become maybe even the envy of other parts of California and maybe even the nation, that we would start addressing this full continuum of care for behavioral health services. And we it took a lot of time and effort to, to work on the plan, and fits of starts and stops and pandemics and things along the way. And here we stand today, having, I think, made it to the other side of that dream, and I think we're on the precipice of getting this done, thanks to Supervisor Montgomery Steppe. Thank you so much, who pushed it over the goal line and got it to where we needed to get it, and to Vice Chair Lawson Reamer and all the supervisors. We had tremendous support from really every single elected official that we have here in San Diego, whether they were elected to the state or representing us in Washington or here in the region. We had everyone supporting us, and it was really, it's really been tremendous to have that kind of support. So our dream now really is to, and you'll hear about it in a minute from Dr. Ko, is to deliver transformational health care, a full continuum of services, to really work on getting people better. If you look at what's happened to particularly behavioral health patients who are Medi-Cal recipients, churn in and out of units, not really receiving the care that they need that will make them better. That's not universally true, but that can be true. And so we really hope to get people back into their lives and work down that continuum, get long-term care, as Dr. Bergman spoke to, and hopefully live and flourish going forward. So with that, I'll introduce, and I have to do a big thank you to Dr. Luke Bergman for being our partner through all these years. And with that, I'll turn it over to Dr. Steve Ko.
Thank you very much. I'm Dr. Ko. I'm a psychiatrist at UCSD, and also I have the privilege of being the current president of the San Diego County Medical Society. And before I address what our department and our university is going to deliver to our citizens across the entire region, I'd like to briefly talk about what I fear as a psychiatrist, as a clinician when I see patients day in and day out. When you look at the data, it's very clear that at this moment we have over 40+% of mental health behavior specialists who are not, whose needs are not being provided. Our patients' needs continue to rise, and our behavioral health workforce numbers continue to go down. This is a major problem that's facing not just San Diego, but the entire country. And so when we think about training of the future, my future colleagues, those who are going to work with me in our EDs, in our inpatient units, our outpatient clinics, out in the schools, taking care of our older citizens with mental health issues, who's going to do these things? Data is very clear. When you train bright, passionate individuals who want to go into this field, if you're taking care of those who are in need, they will then continue to meet that need after they graduate. And how do we address this when we know that our patients need someone who look like them, who have similar background as them, to take care of them? At UCSD, we embrace these challenges, and we are certain that we will be able to meet the demands that our population asks of us. UC San Diego Health, when we look at the population at large, another aspect that we always are concerned about is, why is it that those with the greatest need often get the best services, best quality care, best research, best innovative care at the end of the line? That is not acceptable. Those who are the sickest with behavioral health illnesses should be at the front of the line. They should be the one who's getting the cutting-edge research, cutting-edge clinical care, cutting-edge trainees, cutting-edge trainers every single day of the week. And this is just one step towards that, and we hope that this will set an example for the rest of the state and the country, and in showcasing what an academic medical center and a public institution can do. Our chair at our Department of Psychiatry, Dr. Jeff Daskalakis, is going to be bringing the full weight of our department to ensure that we deliver this care. And our CEO and leader in our healthcare, Patty Mason, has been unyielding in her pursuit of this approach and to ensure that our system is at the forefront as we deliver this care throughout the region. And so I'll end with this, and this is a commitment from not just myself, but our department, our health system, and my colleagues, and that is this, that as the trust has been given to us with the agreement that's about to move forward with the county, we will be there every single step of the way to deliver the best quality care to those that need it the most, and to ensure that we bring the most innovative treatments, research, and best of us every day as we develop this at East Campus. So thank you very much, and I'll hand it back to our supervisor.
Thank you, Dr. Koh. So thank you, everyone. That concludes our part of this. Those who choose to be available for one-on-ones will. I guess we could take a couple of questions if you have them right now. Yes.
Yes, just to clarify, so this will be a facility for psychiatric emergency and treatment?
Yes, and we'll have Dr. Koh or just clarify a bit more for you.
Yeah, there's two types of services that are being discussed today. One is inpatient unit for acute psychiatric patients. So this would be 30 beds on our East Campus. So these are patients who will require minimum and past 24-hour type care and observation. They will be taken care of by psychiatrists, social workers, therapists, etc. The other service line that's being discussed today is a crisis stabilization unit. These are sort of emergency room-esque, but specifically for psychiatric patients, up to 23 hours. And these are patients who are in acute crisis who may not need to go into an acute facility, but who's sick enough that they can't just be returned to the streets or back to their homes. And they can't wait for just their regular outpatient follow-up. And so this is what I consider to be a service line that could fill that sort of gap between acute hospital versus just traditional outpatient practice. And so to have both of them at the same campus, run by same teams, you can imagine like it creates this sort of vertical integration of all different levels of care for our patients in the region.
Can I just, at one point, you can jump in too. I think the other point is that we're going to bring some other services, psychiatric behavioral health services there, including partial hospitalization services, intensive outpatient services, interventional psychiatry services. So it really will be the full continuum of care available for patients, because you don't just go from an inpatient unit to home without that continuum in place. So we'll have that available. Do you want to speak to that, Dr. Koh?
Yeah. The behavioral health needs is pretty complicated, right? And I think Dr. Bergman spoke to this, that we sometimes only focus on the acute aspects of it. But what happens when that acuity is done? Doesn't mean that they still don't need services. And more importantly, and this is something that we need to be talking more about, is how do we prevent patients from getting that sick, right? When I talk to our teams, we often talk about if one of our patients gets hospitalized or have to go to an emergency room, then in some ways we have failed them, right? We need to make sure that they are living their full lives, getting the treatments that they need where they live and where they work and where they are spending their time. And so what Patty has described is a full spectrum of service line that's centered around East Campus, where we will have outpatient services, intensive outpatient services, partial hospital, CSU, emergency medicine services, and inpatient psychiatric services, all sort of within a same geographical space to take care of all the patients that's being needed there. Interventional psychiatry is this unique and new field that's been emerging over the years, and this is to combine talk therapy, which is extremely important, medications, also extremely important, but then now taking the concepts of electromagnetic fields that function within our brains, and how do we bring these three elements together. And this was sort of the missing aspect of the type of clinical care that we know we need to deliver. And so we will be having those at East Campus. And so for the first time, we will start looking at things like transcranial magnetic stimulation, ECT, and other types of services for the Medi-Cal population at a location that's never been done before. So it's very exciting.
which those services were not provided to Medi-Cal recipients before?
So for Medi-Cal population, some of those services have not been available. And so we are going to be starting to provide those services as soon as we start providing clinical care there.
It would include also children, it will be all ages, or just
Currently, the plan is for adults at East Campus.
okay, and the therapies you mentioned, so maybe someone with any sort of spectrum like autism, it could be treated there as well?
So depending on the age group, autism spectrum illnesses span the entire lifespan, as you know. And so current plan is to try to deliver adult age care at East Campus. And I think, working with Patty and others within our health system, one of our visions and goals is to try to make sure that we provide comprehensive care for all ages. And so, like I mentioned before, this is simply one step towards the future. And what's exciting about it is that first step. And we're looking forward to working with the county and really, all of you to make sure that we become that centerpiece for what a behavioral health service could look like.
And the old East Campus, that's the Alvarado, just for clarification.
Correct.
Correct.
Okay, thanks.
That's right. Okay.
Are the 30 beds, are the inpatient portion, and then are there additional beds for the crisis stabilization unit, or is it all just within the 30?
No.
30 is the
Separate.
inpatient.
Okay.
And then there's
Do you know
additional beds
How
for
many
that.
beds?
We already have 32 beds in place for psychiatric beds, so we're going to add another 30. And then the crisis stabilization will be an additional, and we're not sure yet because we haven't done the plans yet. It might be like 6 bays, it might be 8, we might be kind of in that range. We don't know yet until we do the review.
How do you address the behavioral health workforce shortage? Why do you think there's such a problem, and how do you plan to kind of retain people because without them, and you might have beds, but you don't have anybody to treat them?
I feel like this is the topic for a different press conference in a way, right? We're talking about this great initiative we're opening at UCSD, but just think it's important to mention the work we have been doing on that. A couple years ago, we did a study, so we know we're on track to be about 18,000 behavioral health workers short in San Diego County. So we've been bringing forward a number of different initiatives to invest in our behavioral health workforce, including $25 million about 8 months ago that we allocated to really invest in training. That includes loan repayments, trying to get folks into the right kind of training programs. And we're really looking at the whole spectrum of behavioral health workforce training. So one of the biggest challenges we've seen is that kind of peer support specialists, the lower level entry positions that just require maybe a certificate and less time intensive training are really underfilled. And it's much less expensive and much less time consuming to fill those spots. So we're looking at that as well as the more advanced positions. So that's one of the reasons we've been partnering with our community colleges, our local educational institutions, as well as our hospitals to move forward with those training investments. So, but that is a very big question that we've all been working on.
Any estimate of when the new facility will open?
Patty?
It will be a project that needs to go through the state review, the HCI review, so we're thinking it's going to be about 20 months.
Okay. Thank you, everyone. Like I said, those who will make themselves available for one-on-ones will do so. And thank you so much for being here.